welcome to Wellness Woodbridge. I'm your host, Ann Mazza of Vito Mazza Salon and Spa, as well as Hair and Scalp Wellness. I'm here in Edison today at the Johnson Rehabilitation Center here at JFK, also Hackensack Meridian Health, and we're going to meet with some great pain management specialists and rehabilitation specialists here today, answering some great wellness questions for you. I'm sure we all have some things that we could utilize some help from rehabilitation and pain management. So thanks so much for joining us, and we'll look forward to a great show.
So now we're here with Dr. Sagar Parikh, who's the director of this beautiful facility. Doctor, tell us a little bit about what you do here.
First of all, thanks for coming. We're part of a group called the Center for Sports and Spine Medicine, and we're housed under Hackensack Meridian Health, and specifically part of the JFK Johnson Rehabilitation Institute. I know that's a mouthful.
No,
but,
that's great.
So essentially the JFK Johnson Rehabilitation Institute is a world-renowned rehabilitation facility, and specifically what we do is physical medicine and rehabilitation. It's a field of medicine that we take care of disabilities, dysfunctions, pain, injuries of certain degree, and what we try to do is rehabilitate them back to some function, back to their life. And so our subset of that, the Center for Sports and Spine Medicine, specifically deals with musculoskeletal injuries, sports injuries, pain conditions, almost non-surgical orthopedic conditions that's inhibiting someone from enjoying their daily life. So our goal is to employ an arsenal of different types of techniques to help bring them back to function.
That's wonderful. So you deal mostly with orthopedics, but you're here in this area, but you have people probably traveling far to come to you for these services. Sounds very specialized.
Sure. I mean, the one thing what I love about this center specifically is that we truly take care of the patient holistically. What that means is, of course, we have our team of physicians that are either sports medicine trained or pain medicine trained. All of us are trained under the rehab medicine sort of mindset. So we have our team of physicians, but we also have our team of physical therapists, occupational therapists. We have our mind-body experts. We have specialists in nerve conduction studies and EMG, and we have every one of us is sort of exercise-minded and functionally minded, and we work together to sort of rebuild someone back to some sort of physical function and some sort of quality of life.
So hopefully even sometimes to prevent surgery, but if surgery is required, you're helping people after that as well.
100%. What we like to see is we like to see ourselves as coaches. You know, we're trying to coach someone through their injury, through all aspects. So oftentimes when someone would come and see us, they'll be loaded with questions on their arthritis or their back pain or their shoulder pain or anything of that sort. And what we like to do is not just diagnose them and also provide them with some sort of treatment, but also guide them through the natural course of their condition. What are they going to expect maybe after an image-guided injection? What are they going to expect after physical therapy? What can they expect when they're done with physical therapy? And we want to now connect them with an athletic trainer. So we're really trying to empower them with as much knowledge as possible to get them back to independence.
So looking at the body as a whole, it can be so amazing, the way it can heal itself. And you're able to do that as a team and facilitate to each individual case for whatever the needs are.
100%, correct. And so, I mean, I'll give you an example of such. And one of the biggest causes of disability and decreased quality of life in our country is lower back pain. That's a huge issue. So, if I don't mind, I'm going to bring the spine model out here. So, what we know of lower back. So, make believe this is a lower back, of course. We have the front of the body, we have the back of the body here. And so, what people typically know is that we have a series of bones, discs, we have nerves that come out of the spine, and we have certain joints in the spine as well. Any one of these things can cause back pain. But what we don't often address, and what we should, and what we try to do more often now is, in addition to the spine, there's also muscles, there's also ligaments that you don't see on this model. There's also, let's say a lot of us have a gut, there's a gut in the front. Mm-hmm. So in order to actually practice good spine health and good back pain relief, we need to offer them the gamut of treatments, that being proper diagnosis first, perhaps an image-guided injection to one of these areas to relieve some pain, but we also want to coach them on proper eating habits, We want to lose that gut. We want to build that muscular core around that spine to help preserve it. We want to enforce proper biomechanics. So all of this together deals with wellness.
Sure.
So it's not just, let's say, an injection. It's not just, let's say, a medication to help me. It's let's lose that weight. Let's build up that core. Let's improve your sleep. So we're going to add, and let's work on some mind-body relaxation sometimes. So we're working through all of these things together to help improve someone's quality of life.
Well, it sounds great. It's holistic. It's exactly what we're all about on this wellness show, just providing, the clients with that knowledge and that education so that they can do these things and be a partnership with the doctor, not just go to get fixed. It's a different mind frame, and that's what's changed, I think, so much in our society now.
I think you touched upon something really great is, so what I often tell patients is we are the coaches, and we're going to guide you through this whole process. But it's almost 30% us and it's 70% you. So, we can guide you for as much as we can, but we need to motivate you to do the rest. And so the nice thing about this facility, again, also is that we're part of an academic center. So every so often we do have students and we have residents and we teach, but in doing so, the nice thing about it is we can spend sometimes 30 minutes with a patient and really go through that whole aspect of the education, because education is it's within our bones in this institution. And so we actually love doing that.
Well, it's so great that you're here, so close to us, so close to Woodbridge. Edison has always been a great location for us, so we're excited that you're here, that you can help facilitate to this community.
Thank you so much.
And I can't wait to see more of what you offer here, so
Sure.
we're looking forward to that.
Thanks.
So over here, this is the Metaplex. Adjacent to the hospital, what we pretty much do at the Metaplex Surgical Center is most of our interventional procedures, our image-guided injections, different techniques that we've learned over the years to help relieve pain through a non-medicinal route. Over here, the patients would come and just going to go through a general intake. They'll have a seat on one of these recliners. They could even watch some TV if they'd like while they're waiting. But we pretty much go through a little bit of their history and physical again, check their allergies, things like that, set up an IV if we need to. And then once they're ready and once they're consented for the procedure, we then bring them back to the procedure suite, which is this way. So this is one of our procedure rooms. As you can see, it has a big machine behind me. This machine is actually our X-ray device. It looks like a C, but what it does is it allows us to see inside of a patient, essentially. A patient will be lying on this table, and we can have an X-ray view of either their neck, their lower back, their mid-back, even joints, even their hip joint. And with that information, we can actually guide a needle very carefully and very precisely to a specific point and do some of these more precise nerve blocks or joint blocks. After the procedure is done, myself and the nursing staff that will be in this room will help clean up the patient, tidy up the room, and then we take the patient and we bring them over to the recovery area. And so this is the recovery room. After the patient is done with their procedure, they come to this room and we guide them into one of our cubbies back here, have them take a seat on one of these recliners where they can watch TV, they can have refreshments, coffee, cookies, that sort of thing. But mainly we bring them here and we assess them for their pain relief. In addition to that, we answer all of their questions that they may have, and we also set them up with a follow-up visit. So after the patient is done with their procedure here, which all takes place on the same day, we then have them go home and we see them within a week or two for a follow-up to see how they're doing.
So I'm here with Dr. Craig Van Deen, and he's going to tell you a little bit about what he does with ultrasound in this space.
Hi, thank you very much. So I am a sports medicine specialist, and also I have a primary specialty of physical medicine and rehabilitation. As part of my training, I learned interventional diagnostic ultrasound. This is really part of the continuum here at the Center for Sports and Spine Medicine, because what we can really do is offer patients different procedures to help target areas of pain. So I use the ultrasound as a tool, one, to diagnose, to find out why they're having pain, Is it osteoarthritis? Is it tearing of a tendon? Is it tearing of a ligament? Is it inflammation? And then I can target that directly with the needle. We tend to see very good outcomes with this because the ultrasound allows us to get a needle directly to that area and then inject medications to that region, whether it's a steroid or whether it's some of the newer techniques like regenerative techniques such as prolotherapy or PRP.
Wow, that's amazing. So you can take a look right on this ultrasound machine and most of the time see what could be the issue for the patient.
Exactly. So if a patient comes into me and tells me they have knee pain, what I'll do is I'll bring this ultrasound out for our encounter. I'll take a look at the tissue. I'll see whether or not there's bony irregularity. I'll see whether or not there's fluid. I'll take a look at the structures around the knee. And that will allow us to target what I think the pain is coming from. Of course, every time we do this, this is really a secondary approach to the primary means of management, which is physical activity and exercise. But if they're not responding, this gives us a tool to actually go in and try to control the symptoms and then improve outcomes at the end.
And you can be much more precise if there is any medicine or anything that needs to be injected into that area.
Exactly. So this is all about precision and improving accuracy. And we know that with ultrasound, the accuracy is far greater than some of the more traditional techniques.
Sure. So would this be the first step in someone coming, or would this be a secondary step to the first part of the rehab?
Sure. So if a patient comes in, it depends on really what they're feeling at the time. If the level of the pain is so severe and it's not controlled by medications and hasn't been controlled by any of their prior management, we may consider this as a first line. If we can get the pain under control, then the outcomes tend to be better over the course of exercise and physical therapy and things of that nature. If their pain is moderate and maybe not that severe, then we may try exercise first, and then if that doesn't work, we may consider this to get the pain under better control and then go ahead and reinstitute the exercise program again.
Wonderful. So it's always pretty much a multifaceted approach. It's just which one you're going to target first, second, or third.
Exactly. And everything we do is in the best interests of the patient. So there are many different options and many different things that we can inject to control symptoms based off of what the pathology actually is. So we make sure that every patient who comes in has an individualized care plan and that what we do is in the best interest in the patient, and the goal is to restore function and get them back to doing their previous activities.
Sure. So is it always medication, or do you do PRP as well?
So we also do PRP. So PRP is platelet-rich plasma. Basically, we're using the patient's own blood. We're harvesting a component of that blood, and it basically allows, I would say, it augments healing for that patient. So for certain conditions, we know that it works very well, both in pain control and in some instances tissue regeneration. So we do that as well as part of our treatment plan.
Wonderful, because it's actually a wellness situation. They're not injecting any medicine, but their own body is healing itself. Which
Right,
is...
exactly. And that's the ultimate goal. So it's still in its infantile stages in terms of research, but as time goes on, we're learning more and more about the capacity to regenerate and self-heal. And we're hoping to reach the point where we can really make a huge indentation on a lot of these problems that haven't been able to be treated effectively before with conservative techniques.
That's excellent. I mean, it's amazing, you know, what the body can do. So
Exactly.
I know you're going to show us also a video of how you actually target that pain, and you're able to see and help the client right through that. Precisely.
Exactly. So what I'll do is I'll have a video that I will show you, and basically we're going to use a target, which is just a circle. It's used off of a model, and we're going to approach that with a needle, and the idea is to show you how the needle can approach that target, and we can effectively get medication to the region. That's our goal in terms of management.
So Doc, show me a little bit about your equipment and how you actually target that.
Sure,
approach.
absolutely. So let me talk a little bit about the device. The nice thing about ultrasound is that unlike X-ray, CAT scan, there's no radiation exposure. So for patients who come in and get analyzed with the ultrasound, they don't have to worry about any side effects from the machine itself. So the way that it works is we have this probe. Probe has crystals inside of it. What happens is as the electric signal comes into the probe, the crystals vibrate, it sends a sound wave into the tissue, and then based off of the type of tissue that it's coming in contact with, that'll determine how many sound waves bounce back, how many get absorbed, how many bounce off in another direction, and it determines or comes up as an image on the screen that I can interpret. So different tissues will have different properties. So what we use as a medium to transmit the waves is actually a gel. And what I'd like to do is show you a demonstration on your arm so that way we can see the different tissues and you get a better idea in terms of what I'm talking about.
Okay.
So I'm just going to place the probe on your arm and you won't feel anything. So what we can see when I look at your arm, and I'm going to change this to kind of improve the image quality. you can see that there's varying degrees of tissue here. So what we see is we see this sharp border down here, which would be suggestive of bone. We see softer tissues here, which is more suggestive of muscle. And I can actually track things up and down. So I can follow tissues up and down, particularly the course of nerves, the course of muscles, the course of tendons, and it gives me a better idea and really live feedback about what's going on. So that way when a patient comes in, I can put this together with the symptoms that they're having and really determine what the best means of management is for them.
Wonderful. That's great. I don't know if I would know what that all looked like, but I'm sure you do.
Yeah, so it takes a keen eye, it takes a lot of practice, but really anyone can learn it. So what I like to do when the patients come in is as I'm doing the demonstration or as I'm getting the images, I will actually point things out so things are more clear and you have a better understanding of what's going on.
Wonderful. Are you going to show us how you target the actual situation with the needle as well?
Sure, absolutely. So I do have an image with a needle, and basically we have a circular target that shows how we actually come towards a target. So if you watch the screen, you can see that there's a circular target here, which is where I'm going to be pushing my needle towards. So you can see the needle coming across, and I can actually guide it directly to that target. The nice thing is that I can visualize the needle. I can make sure I'm not hitting other tissues, nerves, blood vessels, and then I can implant or put the medication in the region that it needs to be.
That's perfect. I would say if I had a needle going in, I would want you to be looking at it at the same time.
Absolutely.
So I think that makes a lot of sense.
And I think it makes patients a lot more comfortable, and I can use much smaller needles. So I think overall it's a much more pleasant experience for patients who do have to end up getting a procedure.
Wow, so that has evolved over the years, I suppose.
Definitely, and the technology is getting better and better, and we're seeing more and more, both from a diagnostic standpoint, and it's helping us significantly with the interventions.
It's amazing. Thanks so much, Doc.
No problem. I really appreciate it.
I'm excited to be here with Dr. Laurent Delavaux, and he's going to explain what his specialty is here at the JFK Rehabilitation Center. Hi, Doc.
Hey, and thanks so much for visiting us today. So I am an interventional pain specialist here at the Center for Sports and Spine Medicine at JFK JRI, and I specialize in exactly that, in intervening for patients who have any myriad of issues that cause them pain. So whether that's something as simple as a muscle injury, a tendon injury, or things that might be a little more complicated, like involving the back or the spine, you name it, we can offer solutions that kind of fold into everything else that we offer here.
It sounds like it's a very multifaceted approach. Everybody that you're dealing with here seems to take the patient as a whole and then solve the problem between all three of you, which I think is such a benefit to the patients.
That's absolutely right. We have a very collaborative approach in our clinic. So our other physicians who you've met with, oftentimes we're in the clinic together. We get to see our patients together. We all offer our own expertise in treating any patient issue. And once again, you know, that also extends to all of our wonderful physical therapy staff, our occupational therapy staff, all of our adjunctive treatment staff that we have here at JFK.
Wonderful. So you'll be seeing patients prior to surgery and also post-surgery as well?
That's right. So I'm trained in physical medicine and rehabilitation, and as you may have heard Dr. Parikh mention before, our approach is really a non-surgical one from the get-go. So we are trying to help in any way that we can restore a patient's function without having to go to that surgical step. But of course, as part of our continuum, we are involved with and intimately collaborating with surgeons when that may be necessary. And oftentimes, if people do end up having surgery, we can also help them with issues that they have down the road. So it's a constantly evolving process and treatment plan.
So you are based right here, but also there's another area that we're going to be looking at as well,
yes,
where you do a lot of your specific work, right?
That's right. All of our fluoroscopically guided interventional procedures, which is just a fancy way of saying X-ray guided, are done across the street at the same-day surgery center, our Metaplex. And that's a place that is very useful for us because we have specialized equipment that we can use to target our therapies very safely in our patients and provide them with the best possible treatment.
The campus is very vast, very busy, and you're also knowledgeable. It's been so great to be here today to be able to really tour the facility and see all the specialties that you have.
So glad we could show you everything that we have to offer.
Great.
Yeah.
So thank you again for joining us today. This has been a great show right here at JFK Rehabilitation Institute. We're so happy to have you with us, and we look forward to seeing you again on Wellness Woodbridge. Goodbye.